Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the Phia Group.
Good morning, afternoon, or evening, everyone. This is Tim Callender, Vice President of the Client Solutions Group with the Phia Group. We're very excited to have you join us today with this podcast. Long story short, we know it might be 6 o'clock in the morning. It might be 10 p.m. at night, which is why I said good morning, afternoon, or evening, but we hope you're enjoying this on your drive, at your computer, at your desk, wherever you might be. Today, I am very, very excited to be joined by Jordan Feldman. Jordan is the CEO and co-founder of RightWay. He's going to be telling you a lot about why he started RightWay, what RightWay does, and where RightWay is headed. I'm also joined by Linda Pestana. Linda is the director of the Human Resources Department right here at the Phia Group. So she knows everything about me and my ADP employer file. And, anytime I've gotten in trouble, she knows all about it. So hopefully she'll keep those stories to herself today. But in terms of this cast of characters, why are the three of us talking today? So number one, I'm very fortunate in my role. Hopefully a lot of you listening today, we've met somewhere over the past 6, 7, 8 years in this industry, whether it was at a conference, at a meeting. But again, I'm very fortunate in my role that I've been able to bounce across the country, really get to learn and understand our industry, everybody from the employer group itself up to the consultant, the payer, whether TPA, ASO, that stop loss carrier, all the different vendors involved. And so I really maintain an interest at kind of this high level view in the industry. So I'm always very, very interested in the solutions that can kind of impact all the different stakeholders. So I wanted to have an opportunity to discuss RightWay for all of you that are listening. That's why Jordan's on the phone. RightWay is an incredible solution. Again, he's going to describe it much better than I can, but me using my silly words, I view it as kind of like a steerage. I know some people use the term concierge, but it's a service that allows the employer, allows the self-funded health plan to really identify those key areas of care and what they want to do with that member population, where they need to steer them and how to get incredible care at the right places, so to speak. And again, Jordan, I hope you're laughing on your end because I know you'll be able to describe it a lot better. From there, folks, what we're going to do is we're going to have Linda Pestana sort of tell the personal story. And by personal, I kind of mean, I guess I should say more the organizational story, the employer story. So not only do we at the Phia Group, look for key partners that we can bring to the industry and endorse or what have you, but we're also a user of these partners. The Phia Group has a self-funded health plan. I'm a member of it and I love it. I try not to use it. I try to keep that spend down. That's me. I hurt myself a lot, so I do use the plan. But anyway, we do have a self-funded plan and we try to use all those cool innovative solutions. And we've been with RightWay, I'm going to be a little bit off, but Linda will correct me, 1.5 years, if not more, maybe 2 years. And that's where Linda today is going to help us understand a little bit about Phia's experience on our own health plan as an employer with a self-funded health plan and what RightWay's done for us. So I've introduced Jordan and Linda in my terms, but Jordan, perhaps you can tell us a little bit about you, your background briefly. I'd love to hear kind of that origin story. Before RightWay, what was Jordan up to? What were you doing? And then what happened that you said, hey, I'm going to start this thing? And then maybe just tell us where it went from there, if you don't mind.
Absolutely. And thanks, Tim. Really excited to be here today with you and Linda. Quick background on me and the evolution to start RightWay. Grew up down in Miami, have a dad who's a cardiologist, had some few unfortunate healthcare events myself, heart surgery, stomach surgery. So went to college, thought I was going to follow in his footsteps, become a doctor, but after about 2 years of pre-med classes, kind of quickly got out of it into something much easier, but much less impactful. Started my career at Goldman Sachs. I was there for about 4 years, left there to help start a growth equity fund called Redbird Capital. At Redbird, I started spending a lot of time in healthcare services, really reigniting that passion for health and healthcare and prevention and wellness. And I started looking at and diligencing a lot of companies in the healthcare services space broadly defined. We looked at companies like One Medical, in their Series B and C stage, which we definitely should have invested in, but also companies like Healthcare Blue Book and Health Advocate and Accolade and Quantum and, starting to get an appreciation for what was out there, what was being delivered to the underlying member, what impact it was making on their experience and their outcomes, but also how it was quantifying and measuring impact on total cost of care. And after, a few frustrating years of seeing solutions that didn't really solve the underlying problem, weren't really empowering and educating consumers in healthcare to be more efficient, to be more effective, I took a step back and I said, the macro tailwinds here are too strong. We need to build a platform that people actually want to use, that's solving their underlying problem, that's, generating better experiences, better outcomes, and ultimately reducing total cost of care, not only for the employee, but for the employer. So, started brainstorming with my dad, what could we do? What could this look like? And sitting around a lunch table one day, about 4 different people came up to him and said, hey, doc, where do I go for my AFib ablation? And how do I get a cheaper prescription drug? And how do I use this new telemedicine benefit? And how do I get an appointment in your office? And the aha moment was, hey, Dad, what do people do who don't have a doctor in their family, who don't have this access, not necessarily to care, but to care decision support, to, a navigator and a quarterback and a concierge that can hold your hand from the point of diagnosis to the last bill paid. And that's when we knew we needed to start RightWay to become every member's doctor in the family, to give them a centralized, comprehensive platform and resource where they could go to and through to really be empowered around their health and healthcare and get the information and support and tooling they needed to improve experiences, improve outcomes, and ultimately reduce costs. So we've built RightWay over the last 4 years. We're working with over 900 employer groups. We'll have over 1 million members on the platform. But the North Star of what we're doing is, how do we engage members? How do we improve outcomes? And how do we reduce total cost of care? And that's really done through what we call the doctor in the family approach.
I'm sitting here kind of taking notes just because I like to do that. And I just jotted down every member's doctor in the family, and I put all sorts of asterisks and exclamation points, and I bolded it and I yellow highlighted it, because I like everything you said, but I like that the best, right? Because I like the idea. I'll give a silly example. It's the mechanic, right? So I live here in Boise, Idaho, which up until recently was a small town, but not anymore. It's growing and growing and growing. But I kind of grew up in a small town outside of Boise where that concept of the town mechanic meant something. What I mean is there was a familial relationship. I don't mean to compare a mechanic to a doctor, but, I didn't go to the yellow pages. We weren't going to Google. We weren't, just trying to look for an advertisement on where to go. It was, we trust John Doe, the mechanic, and we're going to do what he says. And if he tells us that we need to go see the specialist for the carburetor, that's where we're going to go. So I don't want to put words in your mouth, but my silly metaphor, by way of example, it reminds me of that concept of there's trust, and it's that concept of every member's doctor in the family. Because the picture you painted makes a lot of sense to me. You're sitting there with your dad having lunch, and these people that are lifelong friends, a cousin, a neighbor comes up and says, hey, doc, what about this? And he quickly is able to guide them. And your point, maybe you can expand on it a little bit on this family concept. Point was, so many people don't have that. There's these cold tools out there. You can look something up on the internet. You can flip through a phone book. I don't know if people use phone books anymore. Maybe it's using your iPhone. But there's these sort of cold platforms where you can just look and see which one pops up because someone paid for the ad. But I get the sense what you wanted to create was something warmer. And that's why you use that term, every member's doctor in the family.
Yeah, absolutely. I'm glad you gravitated towards that, because if we were having a conversation with Adam, he probably would have gravitated towards, me failing out of Harvard over the first 2 years. So much more excited to pick up on this thread. But, the notion of the doctor in the family captures a few different vectors. First vector is, someone and something you trust. If you have that doctor in your family and you're at your most vulnerable or frustrated or unhealthy point of your life, you need to have trust. You need to, believe that someone's in your corner, that someone has your best interest, that, someone's really going to support and be there for you. So that's why, people do gravitate towards that person in their family as much as anything. And then secondarily, the care decision support that a trusted advocate, a doctor in the family, is able to provide for each member does have that empathy, does have that personalization, but it also creates better healthcare progressions and continuums. If we just look anecdotally at a member who's going on the yellow pages, going on Google, doing it on their own, versus someone who could go to their dad, mom, brother, sister, and say, where do I go? What do I do? How do I get there? How much does it cost? I know as a healthcare consumer, I'm never going to get in a trap. I'm never going to go to the wrong doctor. I'm never going to go to the wrong intensity of service, site of service, quality of care. And that mapping and that roadmap can be designed for me in a personalized and empowering way. And once you start to look at these progressions of members who actually have that hand-holding and that steerage, you start to look at the 30 to 40% of healthcare spend that's wasteful or preventable, and you can make a big dent in it. You don't have people going to lower quality doctors. You don't have people going to inpatient hospital facilities versus freestanding facilities for that MRI. You don't have people starting with orthopedic surgeons, but you have them starting maybe with physiatrists or physical therapists. And, most importantly, you don't have people going to a less than adequate doctor. So, a big part of what we think we do at RightWay is synthetically narrow that network to make sure we're sending as many people as we can to the top quartile of the network, no people to the bottom quartile, and, figure out what to do in that middle 50%. But, that's where better outcomes, better quality, better experiences, and better costs ultimately live. And, that's part of that relationship with that doctor and the family. And, our platform is, high tech and high touch, right? We have the clinical health guides that are paired to every member, that doctor and the family, but we also have the mobile first digital front door into healthcare that we want people using to access all of this information, to access all of the options, all of the different tools and resources they have. And we think it's this blend of, not just having an analog doctor in your family, but also, in your pocket on the first screen of your iPhone, having all of this rich, empowering, detailed information that's personalized for you. And it's that combination that we believe is really transforming what it means to be a consumer in healthcare.
Yeah, I agree. And something you just said that I just want to emphasize, a lot of folks listening today, of course, you know who Adam Russo is. Adam is my CEO, or to the Phia Group, also become a great friend over the years. And over the last 5-6 years, one thing I've seen him speak all across the country, and he'll get really excited and he'll jump up and down on stage and pull his cell phone out, whatever the conversation is. It doesn't even have to be, something like you and I are talking about today, Jordan, but just healthcare generally. He'll kind of make a joke about how many people open the mail anymore versus how many people are looking at their phone, right? And it's a poignant moment where everyone sort of goes, well, yeah, aha, no kidding. And then he'll say, all you vendors out there in the crowd, how many of you have that digital front door, that digital platform? And there's kind of this sheepish moment where everyone sort of looks around and realizes that maybe they're still mailing letters. They're not using that digital platform. So my question to you, again, I just want to give that quick context. I'm excited to hear you say that because it's something that people in the industry have been striving toward. And clearly, some of our top thought leaders have been identifying for years that it's a very important aspect for successful consumerism. Earlier, you said you wanted to build a platform that people would actually use. I jotted that down. Those are the words that came out of your mouth, which were spot on. And then you just now said that the way you're doing this is high tech, high touch, mobile first, digital front door. I love that term. So I'm kind of jumping and making my own assumption that this concept of how do you build a platform that people actually use, that's probably one of the biggest ways you've done it is through this digital front door. My question is, if you had to highlight one or two things that are really key into making sure there's engagement, making sure people are using your platform, is it that digital front door? Is there another item? What are the one or two key things that keep people using, engaged, et cetera?
I think that's a great question. And I know you and I talk a lot about the importance of engagement and how everything flows downhill from that engagement opportunity. But one of the things that was so striking to me investing in this space in my previous life at Redbird was when you'd look at what was being delivered to the underlying consumer, you started to understand and appreciate why there was no meaningful engagement. I mean, these were the clunkiest, most difficult to use UI, UX. Good luck resetting your password if you ever needed to do something like that. And you really started to appreciate that the notion of being a consumer in healthcare stunk. There was no elegant, seamless, friendly technology to use to actually access all of this information, all of this tooling. So, I think people defaulted to the lowest common denominator and just said, I'm going to call the provider, or I'm going to, email them or mail them. And, you didn't really have this notion of engagement or consumerism. But in terms of the most important features, the first thing that we wanted to do was give you connectivity to your navigator. I don't know about you, but I know when I need something from my dad, I text him. And, it's that instantaneous but asynchronous communication with that person that you trust, with that person that you need support and help from. And that was the starting point. How do we create that connective tissue on your application in a secured environment where you can text your clinical health guide just like you were texting your friend, and have that really dynamic environment to go back and forth about anything and everything you needed. So I would say that's one feature that was non-negotiable for us. You needed access to that doctor in the family through the same formatted medium that we do everything else in these days, which is text. So we have real-time text. I'd say the other feature that I like to highlight is just bringing all this together. I think, we've done such a good job of offering all these point solutions and benefits and value-added features and functionality to the member. But if you expect them to understand that they have a telemedicine solution, a second opinion service, a navigation tool, a diabetes management platform, an HSA and an FSA, and 25 different logins, 25 different use cases, then they're all going to go underutilized and underappreciated. So what we did was pull all that together, be able to tell members at open enrollment, you have one single centralized comprehensive place to go. It's going to have all of your point solutions, all of the benefits you have available to you, and you're going to have your clinical navigator to make sense of it. And now all of a sudden we see people using these tools that are being offered. We see the benefits department saying, wow, we've offered 15 things historically, but we didn't know how to drive utilization there. And by just telling them, hey, go to RightWay, and that will illuminate the ecosystem, we start to see the uptick in appreciation of all these tools and benefits. So, it's the personalization and access to that navigator via secure chat in real time, and then the centralization. And there's a bunch of other stuff that, I could bore you with in terms of what we're doing. But, the care plans, which is the curated and personalized delivery of, where do I go? What do I do? How do I get there? How much does it cost? There's bill advocacy features, there's prescription drug services and support. But, if I parachuted up to 30,000 feet, it's really that, asynchronous communication with your clinical health guide, and then the centralization of all the resources that I think can make a difference around engagement.
That makes a lot of sense, and I appreciate that. I think what I'll do now is, for everyone listening, it's probably important for you to hear a little bit of that personal side in terms of how has RightWay directly impacted a particular employer group. And of course, as I said, you're going to hear about ours. You're going to hear about Phia groups and our partnership with RightWay and, some of the impacts it has had. Really quickly, I'm looking at some numbers here that I think are pretty outstanding. I'll just share those. I'm looking at as we wrapped up 2020. So here we are. It's April 2021, by the way. I should have said this at the front. Shame on me. Here we are 20 minutes in, and I'm telling everybody, that it's April 2021. But for the record, it's April 2021. So as I look at our numbers between the RightWay partnership for 2020, this is something that I find really fascinating. Number one, 6.8 times ROI for Phia, right? And what's important is I want people to really understand that that is an ROI not just for Phia's health plan as an employer with a self-funded health plan, but it trickles down to the employees, right? I assume and imagine the world of the self-funded health plan across all 50 states is similar, obviously a little bit different between all employers, but at least what we're doing is we really do enjoy those savings at the health plan level so that we can pass those down, right? So we can do things like the stand-up desk, what's good for our employee, lower their cost of care, et cetera. So that's a great number, that 6.8% ROI generally for everyone at Phia. A couple other numbers that stand out. See that RightWay identified 16% of our plan members were identified as high risk. From there, RightWay was able to extrapolate that 6% of our health plan's preventable spend was attributed to this population. Now, those of us in this industry, I don't need to say what I'm about to say, but I still like to say it. We're not saying these are bad people because they have high spend. These are people we love and care about. And honestly, it's why we have a health plan, because those are the people we want to take care of most of all. but it's also good to understand, wow, we see that 6% of our preventable spend as a health plan is attributed to this 16% of members that are identified as high risk. What can we do about it? And then what I get really excited about is that pool, that high risk pool, I'm able to see that as we wrapped up 2020, 63% of that high risk population was engaged by RightWay. That's good. I believe it's actually gone up since then. I'm looking at some old reporting to be candid before we jumped on today's call, but 63% of that high risk population was engaged by RightWay to help with steerage in terms of making the appropriate decision. And I love it. I'm going back to it again for all of those members to have that doctor in the family experience to start to help them out. So let me turn it over to Linda Pestana. Again, Linda is the Director of Human Resources at the Phia Group. I work closely with Linda for about 6 years now, one of my favorite people, and she's wonderful. Linda, maybe can you share with us, just in your own words, I guess what I'd love to hear, maybe kind of when did this relationship start? What impact has the relationship with RightWay had on you as the director of the HR department for a company that has a self-funded plan? And then maybe if there's an easy anecdotal story, we won't share names, et cetera, but if there's kind of a nice story that helps us understand how it's worked for somebody at Phia, that'd be great to hear. So Linda, let me turn it over to you.
Hi, thanks. So we've been with RightWay, I think about 2 years, going on 3. You can correct me if I'm wrong, Jordan, but it has had a huge impact on just my day-to-day work as well. You talked about the doctor and the family and who would people go to, for those recommendations, or questions about the health insurance, or, where are they going to go to, or where can they go to for that freestanding facility to get the MRI. And that was me. I did have people who would come to me and ask for any recommendations or, what type of physicians they could go to, or, who's covered, who isn't covered. And so that was a lot of research on my end that I would do. It would be a lot of online research, looking on Leapfrog and trying to see, high quality physicians or, different providers, or, trying to find a self-standing facility within their area that would be convenient for them. RightWay actually alleviated all of that work for me. It is now just going on. They've been able to personalize it to our plan. They do have all of our information right online. Their navigators are wonderful. And it is very simple. They do the actual research for you. I mean, you think about it, if you're going to buy a car or a TV or something, you do all of that research to see which brand is higher quality, what the reviews are. But not a lot of people do that for physicians or hospitals or anything like that. And that's where RightWay came in. They actually do all of that research for us or for our participants. So it did alleviate most of that work from me and most of that research from me. I can tell you a personal story that in finding physicians for myself personally, this would have been helpful a long time ago. We had something like this in place.
Yeah, and what you're saying is before RightWay existed, something that personally experienced trying to find the right care, and it sounds like, I don't want to put words in your mouth, but I could hear the emotion in your voice, which I can appreciate even through the phone. It sounds like it was probably not the experience you wanted, and that was back when you were kind of having to fumble through without that doctor and the family resource. Is that what I'm hearing you say?
Yeah, exactly. And then since we've had RightWay, I've been able to find the right providers, been able to find local hospitals and also hospitals that I've been to in the past that I probably would not have gone to had we had this relationship, let's say.
Right. What I would want to emphasize, and Linda, I don't want to overstep and speak for you, but what I would want to emphasize is so often in our industry, especially people that may not spend their day-to-day in our industry, they hear us always talk about dollars. They always hear us talk about reducing spend, and they think, wow, all these people are trying to do is, make money off of reducing money. And the reality is it's the human impact that we actually all care about. That's the motivation at the end of the day. And so hearing you talk about your story, it's really about making sure that people, these are families, these are people like Linda who need and deserve the best care for good outcomes. And it's almost like, everything Jordan said and everything we're thinking about here, The cost reduction is a byproduct. It's a very good byproduct and a very important byproduct. But hearing that human factor is so key. Linda, is there one or two items you might want to add? And, I've heard you talk about how this has really helped you just in your position. It's freed you up to do things so you can focus on being that director of HR in all aspects and not have to pretend you're a medical concierge at the same time. You provided us some emotional examples of, where this could have been very helpful for you in the past, and now it is helpful for you. Are there any one or two other items you might want to add before we wrap up?
I have personally enjoyed the one-on-one that I've been able to have with RightWay and one of their navigators. I receive feedback all the time from our employees that they also enjoy it as well. It's very simple to use. And Jordan, you've also added in that instead of the texting, you have that call feature now that's on the app, which has been very helpful for some people as well.
Very good. And I'll just remind everyone, when she says Jordan, talking about our co-founder and CEO of RightWay here. So, you still have that personal attention from one of the guys that started this thing, which is pretty cool. Well, guys, I know we've been talking for a bit, and I want to be respectful of everybody's time. So I'll kind of wrap us up here. We've heard some great commentary from Jordan on kind of the origin, where he came from, the why behind RightWay, how it was started, and then how it's delivered now. I love the doctor and the family concept. Linda, thank you for sharing your stories with us, not just as an HR professional and what this has meant for you to have this resource for your department, your enterprise, your people, but for you personally as well. I think that's really outstanding. So the last thing I'll do is, Jordan, if folks listening wanted to learn more about RightWay, where would you like to direct them?
Either check out our website, rightwayhealthcare.com, or always feel free to shoot me an email, jordan@rightwayhealthcare.com, and we'll get you linked up with the appropriate folks on our team.
Well, no, everyone, thank you so much for your time. So we've got Jordan Feldman, co-founder and CEO of RightWay. We've got Linda Pestana, the director of the Human Resources Department at the Phia Group, a frontline user of the RightWay platform. And I'm Tim Callender, Vice President of the Client Solutions Group at the Phia Group. And thank you. We appreciate your time.